Hey, my name is Audrey Cawthon, and this is my presentation on evidence-based practice reducing central line associated bloodstream infections. Abstract: central line infections can be very dangerous to the patient, and they can actually kill the patients. So, central line infections can also be very costly to the hospital. Central line associated bloodstream infections are infections that occur in the bloodstream from a central line. Central lines can either be placed like a PICC line or an interjugular right here. So this is considered a hospital-acquired infection. Here's a statistic that I found online. Nearly 1 in every 20 hospitalized patients in the United States each year acquires a hospital-acquired infection. Central line associated bloodstream infections are one of the most deadly types of hospital-acquired infections, with a mortality rate of 12% to 25%. My objections are that everybody will have a good understanding of the severity of central line associated bloodstream infections, learning how to prevent central line associated bloodstream infections, and the proper way to handle a central line. This topic is important because central line associated bloodstream infections can be very harmful to patients. They are also very costly to the hospital. Now some insurance don't pay for any kind of hospital-acquired infection, so this cost gets put back on the hospital, and that can be just very expensive. So reducing central line infection rate in the hospital is very important, and nurses need to take central line associated infections very seriously because they can be so harmful to patients. The PICO question is, in patients with central lines, is the Wellstar Spalding Regional Hospital policies for maintaining central lines up to date with the most recent evidence-based practices to avoid central line associated bloodstream infections? Evidence for change. So several ways to reduce central line associated infections are using the alcohol impregnated caps, giving daily CHG baths, proper hand hygiene by the nurses before handling central lines, and doing weekly dressing changes on the central lines or PRN dressing changes on the central lines. So here's another little quote that I found. Education on central lines and central line associated bloodstream infection prevention is an easy but effective way to reduce the incidence of central line associated bloodstream infections. So just keeping your nurses educated and informed on the most up-to-date practices on how to prevent central lines is the easiest way to prevent central line infections. So when you're using the alcohol impregnated caps, so the little caps that go on the end of the central lines, so when you take those off, it keeps the ends of the central line sterile. So when you take that off to hook up some IV tubing, then throw that cap away, and then when you take that IV tubing off, put a new cap on the end, and that just keeps it sterile and prevents infection from entering the central line. Given the patient's daily CHG baths, we have wipes or we have the bottles of the soap, and if the patients aren't able to do it themselves, if they are able to do it themselves, then you can teach the patient on how to use the wipes and just wipe their whole body down with the wipes, and this just cleans them and keeps any kind of infection from entering that central line. And then if not, then the nurse techs should be educated on what the proper way is of giving the CHG baths, or the nurses as well if the nurse techs aren't available to do it. Proper hand hygiene. Just reinforce to the nurses how important it is to wash their hands before handling a central line and after handling a central line. This just will decrease the rate of infection. And then weekly or PRN dressing changes. So one little quote I found online: weekly replacement of transparent dressings and replacement of the tubing every 4 to 7 days decreases the risk of patients getting central line infections. So if the dressing is visibly soiled, then go ahead and change it. It's a sterile procedure though, so just reinforce to the nurses, make sure they know how to properly change the central line dressing. And if not, there's just a weekly deal, and maybe have a team around the hospital go around 1 day a week so we know that those dressings are getting changed weekly. Nurses should be educated on the importance of proper prevention of central line associated bloodstream infections. Proper hand hygiene should be reinforced. Teach the proper usage of the alcohol impregnated caps. Teach the nurses and the nurse techs the proper way to give the CHG baths, and teach the proper way of doing a sterile central line dressing change. The nurses and nurse techs have to be taught the proper way to do all of these things. Well, not all of them, but the nurses on all of them and the nurse techs mainly on doing the CHG baths. I recommend that there be maybe a class for the prevention of central line associated bloodstream infections, and that there be a skills check off to make sure that everybody knows how to do all of these prevention techniques properly. And this change will help keep our patients safer, and it will reduce their chances of getting central line infections, which can reduce their hospital stay and reduce the cost of their hospital stay. Evaluation of the project. First, we would have a prevention of central line associated bloodstream infection class. This will just reinforce all the teaching on how to prevent central line infection and the proper techniques of dealing with central lines. So before the class, we can we can look around the hospital and see how many central line infections we have or have had, and we want to try to reduce this rate. So second, we could have a team that goes around and evaluates the way that people are preventing the central line infections. So they could just go around once a week, make sure the dressing changes are done on all the patients with central lines. They can make sure the tubing is up to date, make sure that all central lines have the alcohol impregnated caps on the ends of them, and make sure that patient has gotten their daily CHG bath. And another way with the daily CHG bath, the charge nurse can have a sheet of all the patients on their floor of who all needs the daily CHG bath, and then they just check up with the nurse or the nurse tech and make sure that that bath has been given daily. And then after this has been going on for a few months, say 3 to 6 months, we'll check the central line associated infection rate of the hospital then and make sure that it has been reduced. I expect that the central lines infections should be reduced, and that this is just keeping our patients safer. So in conclusion, keeping our patients safe is our #1 priority. We want to keep them healthy. We want to keep them free of harm. We want to prevent any kind of infection that we can. So this is just a good way of reinforcing all this. Change can be difficult at times, but the outcomes will be greatly benefited by the patients. So the patients will greatly appreciate this if we're keeping them healthy and safe and preventing them from getting any kind of infections. And that's all my references. All right, thank y'all.